Hi, my name is Dr. Darren Kahn, and I am the Program Director for the Sleep Medicine Fellowship at Reading Hospital. The Sleep Medicine Fellowship at Reading Hospital will offer you an all-encompassing educational experience that few other programs will be able to offer. This is going to involve spending time with sleep board certified physicians, as well as physicians that are part of neurology, oral maxillofacial surgery, ear, nose, and throat surgery, weight management, and psychiatry. A lot of residents that are interested in sleep medicine get into the field because of a particular case that they've seen. I really want to foster that interest that they have and let them pursue that in a research opportunity. I feel that we have all of the tools required that they will need at Reading Hospital to fulfill that dream. The sleep lab at Reading Hospital and the sleep lab in our office combined see at least 3,000 visits every year. And that runs the gamut of all of the important sleep pathology. A day in the life of a fellow will consist of seeing patients in the sleep center, in addition to having some administrative time to read up on studies, perform research, and to also do any other activities that they need for the other subspecialties. We anticipate that 3 days a week will be spent in our sleep lab seeing patients with complex sleep disorders such as sleep apnea, central hypersomnias, movement disorders, and in addition to that, the other days of the week, they will be seeing patients in the other multidisciplinary subspecialties such as weight management, psychiatry, neurology, otolaryngology, and oral maxillofacial surgery. And they will also spend 8 weeks at St. Christopher's Hospital for Children in Philadelphia, learning all of the pediatric sleep disorders and learning how to read and interpret pediatric sleep studies. There's not just one particular aspect of sleep. It's a really all-encompassing and comprehensive medical specialty. So we're very lucky to have all of those specialties here at Reading Hospital. I think that it's really empowering to be at an institution like Reading Hospital that has all of the technology and resources at its fingertips that will enable you to learn sleep medicine and practice it going into the future without any hesitation. We have all of the resources here at Reading Hospital to fulfill and promote any of the individual interests from our fellows. The work schedule, I think, is pretty balanced. It's generally 7:30 or 8 to 5 o'clock, seeing patients in the office, and that'll be a few days a week. And then some half days during that week, depending on what rotation they're on, they will spend at the subspecialty clinic, whether that's weight management or psychiatry or otolaryngology. They will rotate through all of the subspecialties as well. Some of the finer points of the Sleep Medicine Fellowship at Reading Hospital are the passionate physicians that comprise the multidisciplinary institution that we have here. I've been very impressed with everyone here. They've come from phenomenal backgrounds, phenomenal institutions and training programs, and everyone has come here for a specific reason. Not sure if they wanted to stay, and everyone seems to have stayed. It's just been a very nice place to grow and raise a family. There's parking, you don't have to pay for it. You can walk everywhere, really, if you wanted to get somewhere. I think one of the other great things about it is kind of the family feel among all of the fields. Any patient I have, I can easily pick up the phone and call the provider that sent that patient. Or if I'm concerned about something and I need to get them in with a cardiologist, I'll pick up the phone and call somebody and I'll get them in that same day. And I think we do that for all of each other here. So the communication for patient care has really been second to none, and I think that only benefits the patient. I think that given the way the world is going, that telemedicine is going to become a big part of all of our practices, and fellows should definitely get involved with that early on so that they're more comfortable with it going forward. Reading Hospital has had a very aggressive and open approach to the telemedicine. They are on the forefront of making sure that they had everything set up in enough time. They're making sure that it's well staffed, and I think it's done a very nice job. All of the doctors that are involved in the sleep medicine program really enjoy and love taking care of sleep medicine, and that will exude in any of the teachings that they have for the fellows. At the end of a year of a sleep medicine fellowship program, you will be able to adequately, appropriately, and confidently take care of any sleep medicine patient that a primary care physician may refer to you.